Welcome back to Barry's Academy. I'm so glad you're here for lecture 2. If you've joined us for the first lecture, you've already explored the promise of AI in mental health, how it can restore time, reduce burnout, and help you be more present with your clients. Today, we're going to address the questions that keep many clinicians up at night. Is this legal? Is this ethical? Can I really trust AI with my clients' most sensitive information? These are not just good questions, they're essential questions. And the fact that you're asking them shows exactly what kind of professional integrity you have that makes you a great clinician. Today, we're going to give you a clear, practical framework for evaluating AI tools, understanding HIPAA compliance, and integrating technology in a way that honors both your professional ethics and your clients' trust. So by the end of this session, you'll have a roadmap for responsible AI use, one that protects your clients, protects your practice, and gives you confidence to move forward. Let's dive in. Let me walk you through what we're going to cover today. First, you'll be able to identify the 5 ethical pillars that form the foundation for responsible AI use. Think of these as your non-negotiables, the things that must be in place before you can even consider using an AI tool. Second, you'll learn to evaluate AI vendors like a pro. We're going to give you a checklist, specific questions to ask, red flags to watch for, and documents to review. You'll know exactly what to look for in a business associates agreement, what encryption standards matter, and how to assess whether a vendor is truly HIPAA compliant. Third, you'll apply decision-making frameworks to know when AI is appropriate and when it's not. AI is powerful, but it's not appropriate for everything. You'll need to know where to draw the line, and we're going to show you exactly how to do that. And finally, we'll demonstrate how to communicate transparently with your clients about AI use. We'll give you sample consent language, best practices for disclosure, and strategies for building trust through transparency. These aren't theoretical concepts. By the end of today, you'll have actionable tools that you can implement this week. Here's the reality. AI technology is moving faster than regulations that govern it. We're in a moment where the tools exist, the benefits are real, but the ethical guidelines are still catching up. And that puts the responsibility squarely on us, the clinicians, to navigate these gray areas with care, intention, and professional judgment. Now, I want to be clear about something. Mental health practice is different from general health care. When a cardiologist documents a patient's blood pressure or an orthopedist notes a fracture, that information is sensitive, yes, but it's clinical data. When we document, it's different. We're recording trauma histories, family dynamics, suicidal ideations, substance use, relationship struggles, and deeply personal disclosures. This isn't just medical information, it's the most vulnerable parts of our clients' lives. That's why ethical AI use in our field demands more than just checking a HIPAA compliance box. It's about maintaining the trust that makes therapy possible. It's about protecting vulnerable clients who have chosen to share their stories with us. And it's about upholding the professional integrity that defines who we are as clinicians. And here's an interesting statistic. According to Simple Practices' 2025 survey, only 13% of clinicians are currently using AI for documentation, despite the fact that we know it can save 10 to 15 minutes per session. So why the gap? It's not because clinicians don't want the time savings. It's because they have legitimate concerns about privacy, ethics, and compliance. And those concerns deserve to be taken seriously. And that's exactly why we're here today. Ethical frameworks aren't obstacles to innovation. They're the foundation that makes responsible innovation possible. When you have a clear ethical framework, you can move forward with confidence, knowing you're protecting both your clients and your practice. So let's talk about the 5 pillars of ethical AI use. Think of these as the foundation of your decision-making framework. All 5 must be present for AI use to be ethical. If even one is missing, you need to pause and reassess. HIPAA compliance. This is a federal law. It's non-negotiable. HIPAA requires that any system processing protected health information, that's PHI, must have specific safeguards in place. This applies to your EHR, your telehealth platform, and yes, any tools that you use for documentation. Violations aren't just embarrassing, they carry significant legal and financial penalties. We're talking fines up to $50,000 per violation, and in severe cases, criminal charges. So HIPAA compliance isn't optional, it's a baseline. Next, we have confidentiality. Now, here's where it gets interesting. Confidentiality goes beyond HIPAA. HIPAA is the legal floor, but your professional ethics codes, whether it's NASW, ACA, the APA, they set higher standards. Confidentiality means understanding the entire data flow, where your client's information goes, who has access to it, how long it's stored, and whether it's used for AI training. Just because something is HIPAA compliant doesn't automatically mean it meets your ethical obligations for confidentiality. AI is powerful, but it's not perfect. It can mishear words, misinterpret context, generate content that sounds plausible, but it's factually wrong. That's why human review is non negotiable. Every AI generated note must be read, verified, and edited by you before it goes into the client's record. Why? Because errors in documentation can impact treatment decisions, insurance claims, and even legal proceedings. Your professional responsibility cannot be delegated to an algorithm. You're the expert, AI is your assistant. Then we have informed consent. Your clients have a right to know how their information is being processed. This isn't just good practice, it's an ethical imperative. Transparency builds trust. When clients know that you're using AI to assist with documentation and they understand how the data is protected, it strengthens that therapeutic relationship. Clients should have the option to opt out without it affecting the quality of their care. Consent must truly be informed and truly voluntary with our clients. And then lastly, we have clinical judgment. This is the pillar that protects the heart of what we do. AI transcribes sessions, organizes information, and drafts notes, but it cannot make clinical decisions. It can't navigate ethical dilemmas, understand cultural nuances or systemic oppression, assess suicide risk, or determine when to break confidentiality. Those decisions require human expertise, empathy, and contextual understanding. So AI is a tool to support your work. It will never replace your professional judgment. If you're evaluating an AI tool and even one of these is missing, that's your signal to stop and reassess. Let's break down HIPAA compliance and what it means. HIPAA has three main components that apply to AI tools: the privacy rule, the security rule, and the breach notification rule. The privacy rule is about protecting individually identifiable health information. This means any information that could be used to identify your client, names, dates, locations, even unique details about their story. The privacy rule limits how this information can be used and disclosed. When you're using an AI tool, you need to know, is this tool processing PHI in a way that complies with the privacy rule? Are there safeguards in place to protect privacy during AI processing? Then we have the security rule that gets into the technical details. It mandates three types of safeguards: administrative, physical, and technical. For AI tools, the technical safeguards are typically important. This means encryption, both when data is being transmitted, that's in transit, and when it's being stored, that's at rest. It means access control, so only authorized people can see the data. It means audit logging, so there's a record of who assessed what and when. And it means regular security assessments to identify and fix vulnerabilities. So when you're vetting an AI vendor, you need to ask, what encryption standards do you use? How do you control access? Can you show me your security audit results? Then we have the breach notification rule. What happens when something goes wrong? If PHI is compromised through a hack, a data leak, human error, the law requires the affected individual to be notified. Your AI vendor must have a clear breach response protocol. But here's the critical part. Even if the breach happens on the vendor's end, you, the clinician, remain responsible for notifying your clients. That's why choosing a trustworthy vendor matters so much. Let's talk about the most important document you need to understand, and that's the Business Associate Agreement, or BAA. Under HIPAA, any vendor that processes PHI on your behalf is a business associate. The business associate must sign a BAA, a legal contract that establishes their obligations to protect client information. The BAA makes the vendor legally accountable. It specifies what they can and cannot do with the data and how they must protect the data, and what happens if there's a breach. So here's the bottom line. No BAA equals HIPAA violation. It doesn't matter how secure the vendor claims to be. If they're processing PHI and they haven't signed a BAA, you're in violation of HIPAA, period. So before you use any AI tool, your first question should always be, will you sign a business associate agreement? If the answer is anything other than yes, you need to walk away. Okay, now let's get practical. When you're evaluating an AI vendor, here's your due diligence checklist. I recommend printing the slide out and keeping it handy, because these are the exact questions you need to ask before signing up for any AI tool. Checkpoint 1, HIPAA compliance. First, verify that the vendor is HIPAA compliant. Ask for proof. Ask if they've completed third-party security audits like SOC 2. Can they provide documentation? And make sure the BAA they offer follows standard practice. Some vendors try to include unusual clauses or limitations. Read it carefully, and if something feels off, always remember you can consult a healthcare attorney. Checkpoint 2, data storage and location. Where is your client's data being stored? This matters more than you might think. US-based servers are generally preferred because they fall under the US privacy laws. If data is stored internationally, different regulations may apply and enforcement becomes more complicated. So ask about retention periods. How long does the vendor keep your data? Do they have a clear data deletion policy? You should be able to request that client data be permanently deleted at any time. Checkpoint 3, encryption standards. This is where you get technical. Ask, do you use end-to-end encryption, both at rest and in transit? If the vendor can't clearly state how they handle it, that's a red flag. Encryption at rest means data is encrypted when it's stored on servers. Encryption in transit means it's encrypted when it's being transmitted from your device to the vendor's servers. Both are essential. Checkpoint 4, access controls. Who can access your client data? The vendor should require multi-factor authentication and means for a password plus a second form of verification, like a code sent to your phone. They should use role-based access control so employees only see the data they need for their specific job. They should have audit logging, which creates a record every time someone accesses PHI. This creates accountability and helps detect unauthorized access. Checkpoint 5, sub-processor transparency. Many AI vendors don't build everything in-house. They use third-party sub-processors, companies that provide cloud storage, transcription services, or even AI models. You have the right to know who these sub-processors are. And critically, those sub-processors must also be covered by BAAs. If a vendor won't disclose their sub-processors, that's a major red flag. And checkpoint 6, data training practices. This is a big one. Ask, is my client data used to train your AI models? Some vendors use client data to improve their algorithms. If that's the case, you need to know about it, and your clients need to know about it. Ideally, the vendor should offer an opt-out option, and if they do use data for training, it should be de-identified first, meaning all identified information is removed. So don't assume this is happening automatically. Make sure that you ask it explicitly when you're doing your due diligence with this. Now let's talk about red flags just a little bit. If a vendor hesitates to provide a BA, that's a deal breaker. If they give you vague answers about data storage or encryption, walk away. If they don't have a clear data deletion policy, that's a problem. Trust your instincts. If something feels off, it probably is. Now, let's talk about informed consent. In my experience, transparency builds trust. When clients know you're using AI to assist with documentation and they understand how their data is protected, it actually strengthens the therapeutic relationship. It shows that you respect their autonomy and that you're committed to transparency with them. When should you get explicit consent? I recommend it in 3 situations. First, if you're using a recording-based system, meaning you're actually recording the therapy session, explicit consent is essential. Clients need to know that they're being recorded, even if the recording is only used to generate a note and then deleted. Second, if the AI tool involves enhanced data processing, meaning it's doing more than just transcribing and organizing information, you should disclose that. For example, if the AI is analyzing patterns, making suggestions, or connecting information across multiple sessions, the client deserves to know that. Third, if there is data sharing with AI vendors, meaning client information is being processed by a third party, transparency is critical. Clients should know that their information is leaving your practice, even if it's being handled by a HIPAA-compliant vendor. Let me give you some sample consent language that you can adopt for your own practice. You may say something like this. Our practice uses AI-powered tools to assist with creating therapy session notes. These tools help us document your care more efficiently while maintaining the same high standards of confidentiality. Your information is protected by the same privacy safeguards as all of your medical records. And our AI vendor has signed strict confidentiality agreements. You can choose to opt out of any AI documentation at any time without it affecting your treatment. Notice a few things about this language. It's clear, it's jargon-free, it emphasizes that confidentiality standards remain the same. It mentions the BAA, which assures clients that legal protections are in place, and critically offers an opt-out option. Consent must be voluntary. If a client says, I'm not comfortable with AI documentation, you should honor that choice and make sure it doesn't affect the quality of care with your client. So bottom line is transparency isn't a burden, it's an opportunity to build trust. One of the most important skills you'll develop as you integrate AI into your practice is knowing when to trust it and when not to trust it. AI is powerful, but it's not appropriate for everything. So let's break this down. You can trust AI for administrative efficiency. This is where AI shines. Transcribing sessions? Yes. Organizing information into standard formats like a SOAP note, a DAP, or a burp note? Absolutely. Generating an initial draft of a progress note? That's exactly what AI is designed to do. These are repetitive, time consuming tasks that don't require clinical judgment. AI can handle them quickly and accurately, freeing up your time for the work that actually requires your expertise. You can trust AI for pattern recognition. AI is excellent at spotting patterns across multiple sessions. It can highlight recurring topics, like if a client keeps mentioning their relationship with their mother or anxiety symptoms escalating over time, it can track symptom changes and flag potential concerns for your review. But notice the key phrase, your review. AI can surface patterns, but you're the one who interprets them and decides what they actually mean clinically. You trust AI for workflow automation, scheduling appointment reminders, billing summaries, insurance documentation. These are perfect use cases for AI. They're administrative tasks that don't involve clinical judgment. Automating them saves time and reduces errors. Let's talk about when not to trust AI. Do not trust AI for clinical decision making. Diagnosis, treatment planning, therapeutic interventions, these require human expertise. AI doesn't understand the nuances of a client's presentation. It doesn't have clinical intuition. It can't weigh competing factors or make clinical judgment calls. Those decisions must rest with you, the clinician. Next, you don't want to trust AI for ethical dilemmas. Imagine a situation where a client discloses something that might trigger a mandatory reporting requirement, but the details are ambiguous. Or a situation involving boundary concerns where the right course of action isn't really clear. These are complex situations that require human reasoning, consultation with colleagues, and sometimes consultation with your licensing board or even a lawyer. AI can't navigate ethical gray areas, but you can. Next, don't trust AI for cultural sensitivity. AI models are trained on data, and that data reflects the biases of our society that has created it. So AI doesn't understand cultural nuances, identity factors, systemic oppression, or even the lived experiences of marginalized communities. It can't recognize when a client's behavior is rooted in cultural norms rather than pathology. That requires your cultural competence and your commitment to anti-oppressive practices. Next, don't trust AI for human crisis situations. Suicide risk assessment, immediate safety concerns, de-escalation, these require real-time human responses. AI can't read body language. It can't hear the tremor in a client's voice or sense when something is deeply wrong. In a crisis, your clinical judgment and therapeutic presence are irreplaceable. So the bottom line, AI is a tool to support administrative tasks and surface information, but at the heart of therapy, the clinical decisions, the ethical reasoning, the cultural sensitivity, the crisis response, that's all you. Now let's talk about why human review is non-negotiable. AI can generate a note in seconds, but that doesn't mean the note is ready to file. Your professional responsibility requires that you review, verify, and edit every AI-generated note before it becomes part of the client record. So step 1, review every AI-generated note. This means reading the entire note, not just skimming it. Verify factual accuracy. Did the AI get the date right? Did it accurately capture the symptoms the client reported? AI can mishear words, misinterpret context, or generate content that sounds plausible but is factually wrong. Your job is to catch those errors before they become part of the permanent record. Next, you're going to want to correct errors immediately. If you find an error, fix it right away. Edit the AI-generated content to reflect accurate information. Add missing context or nuances that the AI didn't capture. Remove any inappropriate content. Sometimes AI generates language that's too clinical or too casual or just doesn't fit the tone of your practice. Bottom line, don't assume that the AI got it right. Trust but verify. Step 3, apply your clinical judgment. Make sure that the documentation supports your treatment plan. Does the note accurately reflect the clinical work you did in the session? Does it capture the client's progress or lack thereof? The tone, language, and cultural factors accurately represented in the note. If a client used specific language to describe their experience, make sure that language is preserved. If cultural factors are relevant to understanding the client's presentation, make sure those are documented. AI can organize information, but it can't apply clinical judgment. That's your job. Lastly, maintaining professional standards. Your documentation must meet the ethical code requirements for your profession, whether it's an NASW, ACA, or APA, and it must meet legal standards for record keeping. This means the note must be clear, accurate, timely, and sufficient to support continuity of care. If you ever had to defend your clinical decisions in a legal proceeding, your documentation would be the primary evidence. AI can help you create that documentation more efficiently, but you're the one who's ultimately responsible for the quality. And human review isn't optional. It's the safeguard that ensures AI-generated content meets the standards of our profession. Now, I want to emphasize something really important. HIPAA sets the floor, not the ceiling. HIPAA is the legal minimum, but as mental health professionals, our ethical code demands higher standards. Confidentiality isn't just about legal compliance, it's about honoring the trust our clients place in us. So let's talk about data flow. When you use an AI tool, here's what typically happens. First, your session note or recording goes to the AI tool. That might happen through an app, a web portal, or an integration with your EHR. Second, the AI tool processes that information, transcribes the audio, organizes the content, and generates a note. Third, the data is stored in the vendor's databases. How long it's stored varies by vendor. Some delete it immediately after generating the note. Others retain it for weeks, months, or even indefinitely if you choose that option. Fourth, the data may be used for AI training. This is where things get ethically complex. Some vendors use client data to improve their algorithms. If that's happening, you need to know about it, and ideally, you should be able to opt out of that. Now, here are some of the best practices for maintaining confidentiality beyond HIPAA. Minimize the data that you share. Only share what's necessary for documentation. If you're using an AI tool to generate a progress note, be selective. The less you share, the less risk there is. Use de-identification when possible. Instead of using a client's full name, use initials. Instead of specific locations, use general terms. De-identification isn't always possible, but when it is, it adds an extra layer of protection. Regularly review vendor security practices. Vendors update their policies, they change sub-processors, and sometimes experience security incidents. Stay informed. Set a calendar reminder to review your vendor's security practices every 6 months. And communicating transparently with your clients. And let your clients know how their data is being handled. If you're using an AI tool, explain it. If data is being stored by a third party, disclose it. Transparency builds trust. Here are 3 critical questions to ask your vendor. First, who has access to client data? Is it just the vendor's employees, or do the contractors and sub-processors also have access? The more people who could access the data, the higher the risk. Second, is data de-identified before AI training? If the vendor's using the client data to train their models, the data should be de-identified. If it's not, that's a serious confidentiality concern. And third, can clients request their data be deleted? Under HIPAA, clients have the right to request amendments to their records. But can they request their data be deleted from the AI vendor servers? If the answer is no, that's something you need to disclose upfront to your clients. Confidentiality is the foundation of the therapeutic relationship, and you need to protect it fiercely. All right, so let's bring this all together with a concrete action plan. If you're ready to integrate AI into your practice ethically, here are the 5 steps you need to take. Step 1, educate yourself. This isn't a one and done task. HIPAA regulations evolve. AI technology evolves. Your professional ethical codes get updated. Make a commitment to stay current. Set aside time every quarter to review new guidance from your licensing board, your professional association, and trusted sources like the APA or the NASW. Step 2, vet vendors thoroughly. Use the due diligence checklist we covered earlier. Request a copy of the BAA before you sign up. Ask detailed questions about data security, encryption, sub-processors, and data training processes. Don't be afraid to push back if you don't get a clear answer. A reputable vendor will be transparent and willing to address your concerns. Even if they're not, that tells you everything you need to know. Step 3, communicate with your clients. Update your informed consent forms to address AI use. When you meet with new clients, explain how AI assists with documentation. Use clear, jargon-free language and offer an opt-out option. Some clients will be fine with AI documentation, others won't. Respect their preferences. Consent must be voluntary or it's not really consent. Step 4, implement safeguards. Always review and edit AI-generated content before finalizing it. Build this into your workflow. Don't let AI-generated notes go directly into the client's record without your review. And maintain human oversight for all clinical decisions. AI can surface information for you, but you're the one making the call. Step 5, monitor and adjust. Stay informed about vendor updates. If your vendor changes their data handling processes, you need to know. If there's a security incident, you need to know. Set up alerts, subscribe to vendor newsletters, check in regularly, and be willing to adjust your practices as needed. If something isn't working, change it. If a vendor no longer meets your standards, switch to a different one. Ethical AI integration isn't a destination, it's an ongoing process. If you follow these 5 steps, you'll be well positioned to use AI responsibly and confidently. So, we're coming to the end of our time together, and I want to leave you with this. Technology is powerful. AI can save you time, reduce burnout, and help you be more present with your clients. But technology alone doesn't make something ethical. Ethics require ongoing vigilance, critical thinking, and an unwavering commitment to the professional values that define our field. Here are the 4 principles to guide your practice. Principle 1, compliance is the baseline, not the goal. Meeting HIPAA requirements is essential, but if your only question is this legal? You're not asking enough questions. Ethical practice demands more. It demands transparency with your clients. It demands accountability when things go wrong. And it demands client-centered decision-making where the client's well-being, not convenience or efficiency, are the top priority. Principle 2, build trust through transparency. Your clients deserve to know how much information is handled. When you're transparent about AI, you're showing respect for your client's autonomy. You're inviting them into the process and you're strengthening the therapeutic relationship. Transparency isn't a burden, it's a gift you give your client. Principle 3, human judgment is irreplaceable. AI can transcribe, organize, and draft, but it can't diagnose, it can't navigate ethical dilemmas, and cannot provide the therapeutic presence that makes healing possible. Clinical decisions, ethical reasoning, and the human connection is at the heart of therapy. Those remain uniquely human responsibilities. Don't outsource what makes you irreplaceable. And Principle 4, commitment to continuous learning. AI technology is evolving rapidly. Regulations are evolving. Best practices are evolving. If you approach AI integration as a one-time decision, you're going to fall behind. Continuous learning is part of being professional. When we approach AI with awareness, intention, and professional integrity, we can harness its benefits while protecting what matters most, our clients' well-being, and the trust that they place in us. That's the promise of ethical AI, and that's the commitment I hope you'll make as you move forward. All right, we've covered a lot today. We've talked about the 5 ethical pillars, HIPAA compliance, vendor vetting, informed consent, when to trust AI, when not to, and how to implement safeguards in your practice. My hope is that you're leaving this session with clarity, confidence, and a roadmap for moving forward. I know this can feel overwhelming, but remember, you don't have to do everything at once. Start with education, start with asking questions. Start with one small step. Maybe that's reviewing your current vendor's BAA, or updating your informed consent, or simply having a conversation with a colleague about how they're approaching AI. If you have questions, please don't hesitate to reach out to us at help@heyberries.com. We're here to support you. And before we close, I want to say thank you. Thank you for the work that you do. Thank you for showing up for your clients day after day, even when it's hard. Thank you for caring enough about ethics to spend your time learning how to do this the right way. The mental health field is better because of clinicians like you. Thank you so much for being here today. I look forward to seeing you in the next lecture where we'll dive into practical ways to use AI in your practice. Until then, take care of yourselves and keep doing the important work that you do.